Let me just quickly go through this. A very brief description of an excellent way to inform the hospital from the EMS. It's a patient's family to hospital communication that can be expedited with a very simple way. And who is at JFK, and the print, this is, I'm just showing one card, simple business card size information card that tells the patient's family when EMS arrives, they give it to the patient, the patient's family, and what's on it is a phone number to the hospital. Please call this phone number immediately because you are the one who can tell the story of the patient. Before the patient arrives to the hospital, if they call, then all the information will be there by the time the patient arrives. All the information what can be given from the family to the hospital in order to make the appropriate decisions. I think it's brilliant, it's very quick, it's easy. Ambulance car, and for a stroke patient, it's started immediately. That's all.
Can I add?
Yes.
So, actually, up at the Gulf Street Stroke Council, we just discussed that because JFK is piloting that. Sorry. Thank you. And everybody was kind of in agreement that all the hospitals would like to participate in that and thinks that it's a great way to get the information quickly. One thing, though, that EMS brought up is it would be better to have a card that has all the hospitals listed with a phone number and maybe their address, but it does have to be a phone number that's going to be answered. Because if they get a recording, they're not going to call and you're not going to get the information. And then underneath is just, kind of a list of information that the hospital is going to need. Because EMS was saying they were getting a little bit, it was getting a little bit confusing about, okay, so which hospital, okay, here's a card for this hospital, here's a card for this hospital. So maybe just have one general card, maybe a little bit bigger than that, that has it all so they can just check which hospital that patient's going to and then give it to the family member.
One point you commented was, I'm not going to carry a Rolodex.
Yeah. So just
And I agree with that comment that the phone has to be answered. I know sometimes how difficult it is to get someone to pick up that phone in the ED. It can be frustrating.
Yeah, so we really have to figure out a good number.